Hello and welcome to this episode of DMC's Medical Matters. Today we are talking about heart health, and joining us is Edith Chittenden, a physician assistant in the cardiology and cardiac surgery department at DMC Harper University Hospital. Welcome, Edith.
Thank you. Thanks for having me.
Well, let's start with what are the facts that our community should know about heart disease?
I think everyone has heard of heart disease. It's very common. A lot of people know friends or families that have had it. I think one of the most important things to know is that it can affect any age, any race. We have patients that have it as early as 30, some people in their 80s, and that it's really common and also very preventable. And I think that a lot of people think that, it's been around for a long time, we've, figured out what to do, but it is still one of the number one killers of African Americans and also the number one killer for women over all cancers combined. So it's really, really important, and it's still something that everyone should be aware of and know their own risk.
If someone doesn't know where to begin with their heart health, what's a simple place to start?
Luckily at DMC, we have an online risk assessment. It's free, only takes a few minutes. You can find it at dmc.org/healthyheart, and it is a short assessment and will tell you where you are on the spectrum and what you need to do next.
We often hear the phrase, know your numbers, but what numbers should we really focus on?
If you go see a primary care doctor or a cardiologist, they'll be able to go over these numbers in more detail and what ones you need to be aware of and what they could mean for you. And these numbers may include your blood pressure, cholesterol, weight, and glucose for those who have diabetes. They'll be able to go over each number with you and what it means for you and what your goals are.
In addition to knowing your numbers, what are some healthy heart lifestyle modifications we can make?
What I usually like to tell patients, the first one, and hopefully is an easy one, especially if you get motivated, is to quit smoking. There's been many studies. We know that smoking increases your risk of heart disease, doesn't matter who you are. And I feel like it's also become a lot more popular, especially in young people, and it's just not something that is good for our bodies. So if you can quit smoking, it definitely has advantages. The other thing is just to get out and move. I feel like people think if you can't go to the gym for a long time, it's not worth it. But even just walking 30 minutes a day has been shown to help reduce your risk of heart disease and overall just improve your physical health. And the last thing I usually talk to patients about is just being mindful of what you eat. We all like to go to a fast food restaurant, like to eat Dunkin' Donuts, McDonald's, whatever it may be, but obviously eating a lot of that or eating a lot of fried food, it goes into our bodies and affects us everywhere on a cellular level and just every even part of inside your vessels. So it increases your risk of heart disease over the long run. So if you can be more mindful of eating salads, fruits, vegetables, that will also be an easy lifestyle modification to make.
And where should people start? Should they start with their primary care physician or cardiologist?
I think if you don't know where to start, starting with primary care is a really good place. They're usually very accessible. It's something that people feel comfortable with. But with cardiologists, they are actually the ones that order the test, more in-depth testing to see if you actually do have any form of heart disease. So if people feel that they're at high risk or maybe having some symptoms such as like chest pain when they work out, or they know a lot of their family members that have heart disease, you can actually just directly refer yourself to a cardiologist and they'll be able to kind of do your assessment and take it from there. So I think, if you're not sure, you can start with primary care, but also if you know, especially if there's heart disease in your family, going directly to a cardiologist is a good place to go to.
Well, thank you for all that great advice today. And like Edith mentioned, a great place to start is taking our online heart health assessment. You can do so by going to dmc.org/healthyheart. And if you have symptoms or a family history, you can also click on the Find a Cardiologist button, and we'll connect you with a DMC cardiologist that's right for you.